Meeting to order. It is Wednesday, August 6, 2025, and we're here at 11 o'clock to discuss employee benefit support with Richard Broaddus, the Partners Group. It's Broaddus, right?
Broaddus.
Broaddus. Okay.
Yes, sir.
Broaddus. Okay.
Yes, sir. Richard Broaddus of the Partners Group. Happy to be meeting with you guys again. I don't have much of an agenda for us today. Really just wanted to take the opportunity to ask some of the same questions that we had talked about the last time I met with Dave and Melissa, and have Tammy in the room that's a little bit more involved in the day-to-day operations of the benefits plan, and just kind of continue our conversation from there. How does that sound to you all?
Yeah.
Great. Is there anything in particular that you guys are hoping to discuss? I know I sent over some materials on a broker RFP process after we had talked the last time. I actually printed out that email if you guys would like a copy just to have in front of you.
Sure.
Thank you.
Yeah, of course.
That was wise.
It helps to bring paper copies, you know. Would you like one, Matt? You guys can share. Sure. I've got plenty, so look at that.
Thank you.
Brought the perfect amount. You gotta love when that works out, don't you?
Yeah, we're doing that right now.
Yeah.
The fuel. Our fuel.
Yeah. Well, and I also brought the initial presentation that we talked through the first time. So I figured we could start here, just talk a little bit more about what the county's doing, so I can understand where there might be some opportunities for us to help you all out.
Okay. Now, do you work with ICRAMP or not ICRAMP, but advanced benefit? Who do we go through our health insurance?
You guys are with the GEM plan,
GEM
the
plan.
Association.
So you do the same thing? Go through
Yep. So I talked to the GEM plan before I met the last time. They're broker agnostic. They'll work with any broker that you guys want to work with. Okay. All I have to do is reach out to them and tell them that I'd be working with the county, and then I can take over representing for advanced benefits. Mm-hmm. So a little high level, I'd love to do an introduction of myself since it's the first time I'm meeting Jeff and Tammy. My name is Richard Broaddus. I grew up in the area here. I graduated from Kellogg High School. My mom's worked for the county for almost 30 years. Her name's Flo Gunderson, works up at the prosecutor's office. My dad, stepdad, called him my dad, Mike, was sheriff for about 6 years. So very familiar with the county and how you guys kind of all operate. It's a portion of my life just growing up. I was always around it. So it's just a second nature to me. I interned at the prosecutor's office when I was in college. I interned at Silver Valley Law with Keisha when I was in college. So I was actually upstairs chatting with all the new interns in the prosecutor's office just before this meeting. So it's really cool to be back and just presenting in this building. It's a really special opportunity. So thank you guys so much for meeting with me to start with. A little bit more about me. I went to college at the University of Idaho. After I went to college there, I ended up moving to Seattle for about 10 years. In Seattle, I worked in employee benefits that entire time. So I worked with large national insurance brokerage agencies on clients from anywhere to 500 employees to 5,000 employees. So I have experience as an analyst, an account manager, a consultant. I've done just about everything you can do on the back of the house when it comes to employee benefits. So know the industry well. Moved back to Idaho in November of last year. My fiance and I relocated to Boise. I'm up here in North Idaho probably once every 2 months. I'll be back at the end of next month. I'll be back again in October for hunting. Then I'll be back again in November and December. So even if I live 8 hours away, I'm here once a month. And the courthouse is always on my list of stop-ins to say hi to everybody. So if we were to start working together, you'd probably see my face pretty often, just popping in and saying hi. So
now, what does your company? Do you have other clients throughout the state?
We do,
obviously.
Yeah. So my company, the Partners Group, we're headquartered out of Portland. We are the Northwest's largest independent brokerage agency. So we have a small private equity share, 30%. Other than that, we're employee owned.
Okay, 30%. Okay.
30% private equity stake. The reason that we did that is to have a bucket of money to acquire other brokerage firms. Yeah. The broker space right now is really active in that mergers and acquisitions environment, where a lot of smaller brokerages are being gobbled up by the large national firms. Our founders decided that we didn't want to be a part of that. So what they did is they took a 30% private equity stake, but then we aligned strategically with a lot of other regional brokers. So we formed a foundation called C2 Solutions that is, I think, 8 different brokerage firms around the United States. And that way we can kind of pool all of our clients to throw our weight around just like a large national broker. So when you take all of those clients into account, we're around the size of the 15th largest broker in the United States.
Okay.
Again, headquartered out of Portland, but we've expanded into, we have a Seattle office, Bend, we have an office in Boise, and an office in Phoenix.
Okay.
Yeah. And we primarily are an employee benefits shop. So our Boise office, we do work on commercial, so the ICREM arms of your insurance.
Mm-hmm.
We have a team that works on that, but what I do is I focus on employee benefits, so your medical, dental, vision insurance that you provide to your employees. And I also don't really only focus on the insurance. I consider myself more of a business consultant that happens to focus and specialize in benefits. So I'm always talking to my clients and employees, or my clients and prospects, about total rewards, the whole environment. So PTO days, all of that type of stuff, your leave policies, and how that all comes together to really attract and retain employees, right? Which is the biggest thing that we're trying to do with our employee benefits package, is make sure people stay healthy, attract and then retain those employees once we get them in the door, right?
Mm-hmm.
So on clients that I work with in the state, I have a client in southern Idaho called Braintree. They do a lot of hospitality. They're about 1,000 employees that we work with. I have another manufacturing company down in southern Idaho, about 175 employees. We also have, a slew of municipalities that we work with as a company. I don't directly work with them right now, but I've engaged with all those people that do work with those companies. We actually run the state fund in Oregon.
Mm-hmm.
So we have a lot of experience there. We have a team that specializes in municipalities as well. So very familiar with the types of benefits and the challenges that you guys face as commissioners and counties, especially a county that's maybe a little bit tighter on the budget right now. Yeah.
So I'm not sure how this works with the insurance. So
Yeah.
How do you guys make money?
Yeah. So typically we make money based off of either a percentage of premium or a fee-based cost. So a per employee per month fee can be built into medical plans or dental plans where you're paying, say $25, $30 per employee per month to your broker. Depending on size, you'll also see companies build in a percentage of premium. So say you're paying $2 million in premium for your medical plan, say it'll be 3%. We take 3% of those fees. It's all billed through the insurance carrier and sent back to us. That's one thing that we had talked about a little bit in our last meeting is there's a compliance process where your broker should be delivering you a broker compensation disclosure letter every single year that illustrates exactly how much money they're making off of each line of coverage. And the compensation based on the different lines of coverage can change. So medical, typically 3 to 5% of premium, or $25 to $40 BEPM, just depending on the company's size, how involved they are in administering the plan. And then your dental is typically 5%. Vision is typically on a sliding scale. So it'll start at 10% up to a certain dollar amount, and then after that dollar amount, it drops to 7%, and then it keeps dropping on down. And that's typically how your life and disability plans are built as well, and how your broker gets paid off of them. But I would say
so life and disability is about 10%. You said
typically 10 to 15% graded. So it's not usually a flat 15%.
Okay.
It'll be 15% up to the first $20,000 in.
Okay.
And then the next $20,000 is at a 12%.
So it's a graduated.
Exactly.
Yeah. Okay.
Yep. It's a sliding scale based off of the total premium that you pay. Yep.
Okay.
And did you guys happen to receive a broker compensation disclosure from your broker this last year?
I'm sure we probably did.
Yeah, we probably.
I think that was when Mark Fisher,
Mm-hmm.
when he came, met with you guys. I'm sure that's probably what he gave you guys.
And I know from watching some of the YouTube videos, one of the guys that was in here in July of last year, James Pinkerson, had mentioned he was going to send it to you. So I would think that it probably came through email. It's not something we typically pass out in person.
Right, it probably is coming in.
But yeah, you guys should have something somewhere that shows how much you're paying them.
Okay.
Yeah. And just to talk a little bit about how I work with clients on, day-to-day, monthly, annual basis. We have an account manager that gets assigned to our clients. That is our day-to-day contact. I'm unique. I like to be engaged with all of my clients. So I ask to be CC'd on every single email so I know what's going on with absolutely everything. As I mentioned, I'm in this area a lot. So if I were to work with the county, I'd probably be popping in once a month just to say hi, check in on you. How's everything going? Are there any questions? any feedback that can be passed along. But then on a holistic strategic basis, I'm typically meeting with my clients 4 to 6 times a year. And the process typically starts with what we call a pre-renewal or a post-renewal meeting. So say you renew in October, right? Typically I would come back to my client that renewed in October and December or January and just have a debrief conversation. How did it all go? Did we change any plans? Was there any questions that came up through open enrollment we weren't able to answer? How did it feel for you all? So that way we can continue to improve on our process year after year, right? After that, another couple of months later, we're going to have a pre-renewal strategy-based discussion where we're talking about the trends in the market, what we're seeing as potential increases, what benefits could we maybe tweak? Do we want to look at asking employees to take on a larger portion of your insurance costs? All of those things, talking about a wellness fair, thinking about how do we strategically address the renewal that we have coming in front of us. After that, or also at that conversation, we'll decide if we're going to do any marketing around your benefits plans. We're going to send it out to other insurance carriers to see what costs we would be given for moving networks. Along the way, there are things that you want to double check. Make sure you have your network coverage. You still have hospitals that are accessible for your employees to get into. Double check those rates. So in that time, after that meeting, I will go back with my team. We'll do all the work that we had talked about, all the marketing, the bidding, and then we come back for a renewal meeting, which would typically be, I would guess, May to July, somewhere in there. When we're sitting down talking to you about, here are all the options that we found in the marketplace for you. If you have any plans that we decided to look at, here are how they shake out. Here's some financial modeling if we want employees to take on a higher or lower portion of the total premium. And at that meeting, we're really just going to talk through, okay, how does this feel? Where are we at? What do you think? Because at the end of the day, I'm a consultant, right? Mm-hmm. My job is to educate you, to help you make educated decisions, right? My job is not to tell you this is what you need to do. This is the only way to do it, right? You guys understand the county much better than I do because you're in it every single day, right? So that's where we're having those open-ended conversations of what feels right. What direction do you want to go with? At that meeting, or after that meeting, we'll come up with some decisions on what plans we want to go with, what contributions. We'll go back, finalize all of that, communicate it to the carriers, and prep for open enrollment. And then open enrollment will come along for you guys. When do you post open enrollment typically?
In August.
In August? Okay.
Yeah, it's going to start August 21st.
Okay. That's kind of what I figured. You typically want to do open enrollment about 2 months before you renew. Mm-hmm. That way you have plenty of time to get everything into your systems and all of that.
You said August?
It's going to start August 21st. I
21st.
just sent Angela an email actually just right before I came in here to ask how long. It's going to be the same as what last year was, but I don't remember exactly the cutoff date. So I'm having her specify that for me so I can let everybody know.
Okay. Do you typically do 1 or 2 weeks, 3 weeks, somewhere in there?
It's usually dependent on the timeline. It seems to me last year it was about a week.
Okay.
That the open and that's open, So I'm guessing it's going to be about the same.
Gotcha. Sure. Has that felt like enough time for everybody to
It is.
And stuff in the past? Some
years, there has been a couple of years that we, for whatever reason, we could only have it open like for 4 days.
Yeah.
That was not good.
Yeah.
That wasn't good. So I think it's dialed into about a week now.
Okay. Yeah. That's good to know.
Yeah.
I think typically employers of your size would probably do 2 weeks just to give you a little bit more room. Typically when employees enroll, you have your early adopters, right? That get it done right when they get the email, and then you have a gap of people not really doing it.
Yep.
And then right before it's due, everybody jumps in and gets their elections done. So
yep.
that's why we like to see a little bit longer of a time frame, is maybe in that it gives a little bit more opportunity in that middle ground to encourage some people to get their enrollment done. And we had a company that just went through open enrollment, and we sent out reminder emails a week before it was due, 3 days before it was due, a day before it was due, and just kind of making sure you're pinging people and pushing them along in the process. So after open enrollment, we will work with you all sitting on implementation meetings if you changed any carriers, making sure your file feeds are up to date. You guys use Employee Navigator, correct? Okay. How are you sharing that information out of that system to your insurance carriers? Is it an automatic feed that comes out?
I believe that is what Advanced Benefits does to Gym Plan.
Gotcha.
I believe so.
Yep. So there's a couple of different ways to do it. You can set up an automatic electronic file transfer that will take it completely out of everybody's hands. There's just a little bit of implementation time in the front end, but then after that you can kind of wash your hands. Anything you put into the system automatically gets shared with your insurance companies.
And that may be what they're doing, because we had an issue, and it was kind of between advanced benefits and Blue Cross. I mean, it was a talking problem, let's put it that way, with our vision portion of it. But it very well could be that. It could just be that automatic feed.
Yeah. And technology, right? It's great until it stops working. Right, exactly. And that's when you plug in, you have those face-to-face or over-the-phone conversations, get everything figured out and move forward. So after open enrollment, your plan renews, and then we're right back into the same kind of cycle. We're back talking about post-renewal, into strategy, into renewal, and then back into open enrollment again. So year over year, again, I'm meeting with my clients 4 to 6 times a year, face-to-face, and even virtually, if that's something that we want to do. I also review claims experience with my clients on a quarterly basis in a meeting format. I share that claims experience on a monthly basis with my commentary on what I'm seeing in your utilization in the back end. How are you all currently being shared your utilization data through advanced benefits?
I don't know, is that what Mark brought this last time? Did he bring it to us? I don't think we got it in an email.
I think he might have brought a report that...
I think he did.
Yeah. So it sounds like maybe you're getting it once a year currently.
Yeah, maybe. Yeah, maybe.
Yeah. So, again, that's a differentiator for me is I would be providing it to you every single month. That way you stay on top of trends. That way you know if somebody has a cancer diagnosis that's really going to drive your claims cost in the year coming up to renewal, right? And then we're sitting down and we're taking a deeper dive into specific diagnosis every quarter. So that manufacturing company that I was talking about in Boise that I'm working with, they asked me, what do you think our biggest cost drivers are? And as somebody that has a history in data analytics, I can dive in to their portal and really dig at things. And what I found was they had really high musculoskeletal diseases. So a lot of that's like your arthritis, your knee replacements, your hip replacements, things like that, right?
Oh, I know what you're talking about now.
Yeah.
James actually got it to us a couple times last year because I remember him talking about the claims,
Yep.
and how high we were.
Yep.
I think I brought it in and showed it to you.
Yeah, that's what it is. Yep.
Yeah.
Now after you explained it, now I know
because
more
first,
about what you're talking about.
You gotta hit some of the buzzwords.
Yeah.
You gotta get those keywords.
You gotta kind of lead us around them. Oh
Yeah, exactly. Yeah. So it's like every quarter we're talking about those things. What are your cost drivers? And then at strategy, we're really planning on how to cost contain those specific things, right? So for that client, we talked about a boot program through Red Wing Boots that you can offer. There are insole programs that you can do that help align people's bodies so that way it takes a lower stress off of them. And we talk about all of those different diagnostic categories and how we can strategically target them to contain those costs, especially with like diabetes is a really, really big thing that you can drive a lot of outcomes and cost containment with. So a lot of those opportunities are not only cost containment, but it makes people's lives better.
So what you're saying is if we implement that, we get a cheaper insurance rate in a way.
In a way, yes.
Yeah.
So a part of your insurance, right, is how often your employees are going to the doctor and accruing claims, right? If you can get in front of that and make your population healthier and they're going to the doctor less, they're accruing less claims, you're going to get better increases, right? Or better renewals, maybe decrease, something like that, especially if you can target one certain thing that's really driving costs, like diabetes. Diabetes management can be really, really costly if somebody is not checking their insulin, taking their diabetes medication, and there are opportunities around implementing a program that really helps people adhere to those guidelines their doctor gives them and saves so much cost on the back end for the plan. Right.
Okay.
So that's another thing that kind of builds into this whole strategic annual conversation is reviewing experience on a month-to-month basis where I'm sending it out with an email with some of my commentary on the direction that I'm seeing for the plan. And then we're sitting down on a quarterly basis where we're actually talking to it. And Another portion of this that I'm curious about is how often do you guys want to be seeing your insurance broker? Is it something where you're happy with seeing them once, maybe twice a year currently? Do you want somebody in your office more like 4, 5, 6 times a year? In here maybe every month? What feels right to you?
And I think it's, with you, it'd probably be nice more
Have-
frequently because you have more questions, possibly.
Yeah.
Where we, we can. What do you think?
Well, since the first time he spoke,
Mhm.
I think this is like some of the other, like the city's service Valcon the other day.
Mhm.
I think we should consider putting this out for a proposal just to make sure we're getting the most bang for our buck in terms of service and cost. And after listening to him talk, I think there may be a few other bits of service that we haven't seen or heard of or are known to ask about.
Yeah.
They may or may not be available, but I think it'd be interesting to look at an RFP process to bring out whoever our advanced benefits, you guys, whoever, what services are they offering, and this fee structure. I would like to know more, like how much are we really paying our current. So for cost control and quality of service, I think we ought to discuss this idea of an RFP.
An RFP takes quite a while. It takes a
Yeah. So that's what this email is here that I had sent out before. Dave, I know we had talked about a broker RFP when we met this last time, and it's a process that counties go through pretty often. I think I told you, Melissa and Dave, I recommend companies looking at a new broker every 3 to 5 years, just to make sure costs are staying competitive and you have the best service that you can get, and you understand what's out there in the market, right? And that's something I'm very upfront with my clients and prospects about. Like, even if I'm your broker for 5 years, go take a look. Make sure that you still want to continue to work with me, because I want it to be a beneficial relationship, right?
Exactly.
And in this email, there were a couple of attachments that I included. One was the RFP that Canyon County did, that we actually submitted a bid on. One of my colleagues down in southern Idaho submitted a bid on. I'm not sure if they've made a decision on where they're going yet, but again, we submitted a RFP response on Ada County as well, so we're involved in answering RFPs pretty often.
Okay.
I also went through and outlined a few things for you in this email about the timing that a broker RFP really takes, and if it's worth the county's time to a certain degree to go through that entire process if you may already know who you want to partner with, right? Typically, what you're going to see on a broker RFP, there's a timeline outlined on the second page here that assumes starting an RFP at the end of June. So you would distribute it June 25th, and then questions would be due from brokers about 3-4 weeks later, July 15th. You would all answer those questions about 10 days later. Proposals would be due August 1st. You would have tentative award the contract on August 15th, and then you have to put it open as a county, any objectives or any objections to this partnership, right? So in Canyon County's case, it took them about 3 to 4 months to go through a broker RFP process. And just anecdotally, what this looks like from the county's time is a lot of time investment from the Board of Commissioners. So first you have to compile the RFP, right? So before you even release it on June 25th here, you have to spend however long it is to compile your RFP. That can typically take anywhere from 20 to 40 hours to figure out the questions that you want to ask, right? Then you deliver that, you send that out, give about 3 weeks for people to come back. So you're about, if it takes you 20 to 40 hours, you're maybe 2 months into the process already. People will come back, ask you those questions, and then as soon as they get asked, the county has to sit down and make sure you're answering those questions as soon as possible, right? So that can be a lot of time invested for you guys as well. After you answer those questions, then you're going to get the actual proposal responses from all of the brokers, right? Typically, what we see municipalities do is post the broker RFP on a website, and anybody can apply, right? So I would guess in the county, you're probably going to have 5 to 10 people replying, right? Each of those proposals is going to be 100 pages long. So you're going to be reviewing 500 to 1,000 pages of broker
Especially
responses.
for insurance.
Exactly.
Yeah.
Right. Like we just delivered a
Fuel, it's a little bit different.
yeah. There's a couple more things going on in the
Yeah.
insurance plan
Okay.
that you want to have addressed, and really it can be a skinny down RFP that you're sending out, right? Where you're maybe asking 5 questions and then
Mhm.
leaning on those finalist presentations that would come after people have delivered the RFP or
Mhm.
the proposals back to you. So again, but we just responded on an RFP last week, and our response was 89 pages. So that's 89 pages of material that you'd have to read through as a commissioner yourself, and really vet which of those proposals you wanted to have finalist meetings with.
Mhm.
So you have those 10 people, you go through those 1,000 pages, you decide, okay, these 3 are the people that we want to talk to, these 5 are the people that we want to talk to. Typically, you take a week out of that time, and you'll give brokers about 2 weeks to a month to prepare for a presentation. So now, after we've delivered the proposals, we're 3 months in, and then you give another 2 weeks or so for people to come and present. We're about 3.5 months in. Then you're going to have those meetings, which typically will be an hour and a half per person. So if you have 5 people that are replying, right, you have about 8 hours of meetings that you're sitting in during that. And then you guys go back and deliberate, kind of figure out what that looks like and who you want to move forward with. If you want to have follow-up presentations, that can add things to the end of that, right? So this is just all to illustrate how much time comes into doing a broker RFP from the insurance side, right? And the thing that I would encourage you to think about is how much money is the county going to save during a process this long, right? I don't know how much you're paying your current broker, but let's say for purposes of our conversation, it's $50,000 a year, right? If you got a 20% savings on your broker fee through all of this, you're saving $10,000.
That's right.
Is $10,000 worth 3, 4, 5 months of the county commissioner's time? So that's another thing that I put in here is I actually found a resource through the Idaho Association of Counties that talks about, it's a county official handbook, and it talks about procurement process.
Yeah. Yep. And we have. Yep. I know that
And,
one.
yeah,
Yep.
and it sounds like you're familiar. And one thing that says is basically if you're paying less than $75,000 for a service, it's probably not worth your time to actually go through a broker RFP process, right? So that's kind of the idea of the process, how much time it would take from your guys' perspective,
and I can see that because all the different insurance quotes and everything else that we have to do, and
and in full transparency, as brokers, we're all going to get the same rates. It's just who is going to maybe different carriers that one broker is not going to, who's doing a bit more of the work and having negotiations and conversations of how to price somebody, right? We kind of all do most of the same things. So those proposals that you're going to get, it's going to be 100 pages of 10 of them that are almost identical, right? We all have very different value or very similar value propositions when it comes to our companies. We just do some things a little bit different, but at the end of the day, we all do the same stuff. I think what it really comes down to is who do you trust to work with? Who do you think is going to work the hardest on your behalf to find the best discounts and the best price for you all? That's typically what I'm telling my clients and prospects when I'm discussing with them, looking at other brokers.
Okay.
Yeah. So do you have any questions about that process that I might be able to answer for you?
No. We would just have to go back and look to see what we're, what that is right now. I don't have it off the top of my head. But maybe we can, revisit this next week.
Yeah. And like I said, I'm going to be back up here in a month. So if it makes sense,
or you can do telephone call or whatever.
Yeah, I'm more than happy to do a phone call or a Zoom call or
Zoom if it works. Is it working? Is the Zoom working good?
Yeah.
Okay. Yeah, we can do Zoom. Or,
I'm happy to meet anyway. And then another piece of this is just if you guys decided not to go down the broker RFP process and say decided to work with me, what would that process look like? Just so we can set the table a little bit of what that change would look like and how much work goes into it from your perspective, right? Because I think there's this misconception with a lot of companies that changing your benefits broker is a really heavy lift for you. When at the end of the day, there's some work that comes into it, but my company tries to make it as easy as possible for you. So say, you all decided to work with me. what we would do is we reach out to you and get your login information for Employee Navigator. We would go in ourselves. You wouldn't have to do any of this. Go pull all of your enrollment data, go pull all of the structure of how the system is built. Because at the end of the day, the data that is in an Employee Navigator is owned by the insurance broker. It is not owned by you guys. So I've actually had interactions where I took over a client that was on Employee Navigator and their current broker cut off access day of. So they couldn't even access their own enrollment. And unfortunately, that does happen. I don't know what your guys' relationship is with Mark or the people over at Advanced, but that's a conversation that you can have, right? Because there is a process where they can just sign over the rights and we just flip it right over. Everything's live. You don't experience any changes, right? Then we would sign a broker of record letter. I would deliver that to all of your current insurance carriers and start to collect all of your information from them. So your contracts, enrollment forms, all of those things that I'm sure you have on hand somewhere, we take you out of that process and we go and find it all for you. It's very streamlined. And then we're right into that 4 to 6 meetings a year and all the strategy. We build out your utilization reporting, do all that behind the scenes so that way you guys don't really have to be in the process. Now, obviously, questions come up along the way, and we have, opportunities to maybe optimize some of your systems and things like that, and that's where we'll engage with you during that takeover process. But overall, from the county side, it would be a relatively small lift to make a broker change.
Okay. I think it would be a good idea to maybe go back and look and see what what we're paying now, and if we can, and then if we can make this work, if it's a better deal, then maybe we can do a RFP next year.
Yeah. Well, yeah, I think the idea of exploring it and keeping it competitive would fit with what we've been doing with the rest of the county. So
I agree.
Yeah.
Okay.
I am going to have to step out. I have an 11:30 meeting over at the sheriff's office.
Do we have any other questions or anything?
This request for proposal, that's just when Canyon County wanted to do it, right?
Yep, it's one that they did this last year.
Right, but my point is, you're the busiest time of year with the budget and stuff, so they could actually do it in January.
Yep, you can do it at any
If
point.
you're gonna meet 8 hours on meetings, it'd be nice not to do it during the busiest time.
Exactly, and this timeline I had put together was based off of we had met in May. If we had made a change, if you guys wanted to launch that in June, would have looked okay. But Dave, I don't want to keep you any longer.
Well, I wanted to thank you for your time.
Yeah, thank you so much. I appreciate it.
If there's any
Great
other
seeing
further
you.
questions?
You'll have to tell Holly and Lance over there hi for me, okay?
Well, if there's no further questions, we'll adjourn the meeting.
Perfect. Nice and easy.
Okay.
Great.